Hi, I'd like to welcome everyone. I'm Dr. Sarah Vitone, and I'm representing the Regulatory Ethics Knowledge and Support component of the Georgetown Howard University's Center for Clinical and Translational Science Ward. We also encompass MedStar Health Research Institute and the Veterans Administration here in DC, as well as the Oak Ridge National Labs. So our group is really proud to present Dr. Mirabal-Beltran this morning to talk about her program, W.A.S.H. It's a community-based participatory research collaboration. Dr. Mirabal-Beltran received a PhD in public health from the Departments of Population, Family, and Reproductive Health at the Johns Hopkins Bloomberg School of Public Health. Her dissertation examined the relationship between ethnicity, race, and repeat cesarean birth among Hispanic and non-Hispanic women with a previous cesarean birth. Her research interests include women's health inequities with a focus on patient-provider communication. She is particularly interested in the use of community-based participatory research to facilitate access to health and health education in underserved communities. Dr. Mirabal-Beltran was honored to be named a 2020 Health Disparities Institute Scholar by the National Institute on Minority Health and Health Disparities. She's a member of the Association of Women's Health, Obstetric and Neonatal Nurses, and the National Association of Hispanic Nurses. And as my colleague, I am pleased to welcome her today. Thank you, Roxanne, for joining us. I'm going to unshare my screen.
Okay, great.
So that you can share yours.
Okay.
And the participants can use the chat feature, the QA feature. There will be an evaluation. We'll send you an email, but you can feel free to go off camera while the presentation is ongoing.
And then just to confirm that you all can see my...
This is your disclosure slide, yes.
Okay, perfect, perfect. So first of all, good afternoon, and thank you so much for the opportunity to speak to you about my study today. I'd just like to start with just getting some housekeeping out of the way. So I don't have any actual or potential conflicts of interest to share or any relationships with companies that would cause any conflict of interest. The research that I will report in this publication presentation is supported by the National Center for Advancing Translational Sciences of the National Institutes of Health. And it's also the sole responsibility of myself as the author and PI, and does not necessarily represent the official views of the NIH. I also wanted to kind of start with a general overview of what I hope you will walk away from today's seminar with, and that's a greater understanding of our project W.A.S.H. and its aims, understanding the steps that I took in W.A.S.H. to make sure to lay the foundation for a community-based participatory research or CBPR collaboration, and also discuss a little bit of the early challenges that I faced in conducting CBPR as an academic researcher. So W.A.S.H. Actually is an acronym, and it stands for WASH and Spin to Health, or Washington Avanzando la Salud Hispana. And it's a CBPR collaboration between myself, an assistant professor at Georgetown School of Nursing, as Dr. Vitone mentioned, and the community laundromats in wards 1, 4, 5, and 7. And although I am the speaker today and the PI on this project, our community advisory board is an essential and integral part of our project. And so it is apt that their name appears here first. In fact, I know that Mr. Ra Amin actually is joining us on the call today. So I know you can't speak to me, Mr. Amin, but sending a shout out your way. So we have community residents from wards 1, 4, and 5 that are represented in our community advisory board. I also have representation from laundromat owners in wards 4 and 5, respectively, with Ms. Jane Loli and Mr. Myron Ward. Christina Maria, Kiana Mitchum, and Laura Warby also represent not only residents, but healthcare providers. So they have worked for a number of years with women in wards 1 and 5 and 7 and 8, actually. Nataki Smith-Simmons is a former postpartum doula working with women in Ward 5 with a focus on ancestral medicine. So she brings a very unique lens to our CAB. And Tiffany Tyler is actually a recent graduate nurse from Trinity College in Ward 5. And this project would not be a successful example of community research without the guidance, time, interest, and dedication of these and other community members like Renee McCrae, Fred Jackson, and Helen LaCroix, who have all informed the study at various stages. So what exactly is this Project W.A.S.H that I keep mentioning, and why was I asked to speak on it today on the topic of community research? So to put the project in context, just a little bit of an overview. In 2018, the DC Primary Care Association interviewed a sample of women living in DC. And the study participants at that time identified a lack of fertility and pregnancy knowledge as being the primary reason why they did not get prenatal care immediately. And a couple of years before this report was actually published, I was sitting in a laundromat in Wheaton, Maryland, working on my dissertation. And I looked up in one of those moments where I couldn't focus, and I realized that I was surrounded by women that were waiting for their laundry cycles to finish. And these women, for the most part, either were spending their time just scrolling through their phones or blankly staring at a soccer game that was playing silently on the televisions throughout the laundromat. And so it struck me then. I said, you know, what if we did community health outreach at community laundromats? And so I turned to the literature, of course, and that truly showed that inequities in healthcare access have been successfully addressed through targeted health education interventions in places where individuals live, where they work, play, pray, socialize. We've seen interventions successfully rolled out in churches, beauty salons, and barbershops. In fact, it was the work with beauty salons and barbershops that introduced me to Dr. Laura Lennon from the Gillen School of Public Health at the University of North Carolina in Chapel Hill. And she has done amazing work over decades down there with barbershops and health outreach through the barbershops and beauty salons. And so this proposed project was born. And our proposed 3-phased mixed methods study examines the effect of an educational intervention, or EI, on a maternal or reproductive health care knowledge of non-Hispanic, Black, and Hispanic women living in DC's wards 1, 4, 5, and 7, as well, and very importantly, the feasibility of having this EI delivered in community laundromats using a community-based participatory research approach, or CBPR. So, you know, why CBPR? You know, so my interest in CBPR actually first began when I arrived in DC in 1995, and I didn't even know that it was called that then. And at that time, I was working at La Clínica del Pueblo and GHUCCTS Free Clinic. And so both of these clinics are free clinics that serve the DC community, and both are still in existence. They're long-term partners of the community. And at that time, I first learned the amazing work that these community organizations were doing in the community. But I also quickly noticed that many of the researchers engaged with work in these clinics knew much about the perceived weaknesses of the community, but very little about the community's strengths. And very often when the data collection phase was over, they would disappear back into their ivory towers or government buildings, and whatever program or project had been launched was left to flounder. And so at that time in my career, again, I wasn't aware that there were different approaches to research, approaches that acknowledge that the community is its own expert, and that their research is not a vessel of all knowledge, that there is a need to approach our local communities in the US somewhat with the same cultural humility that we often advocate for communities in international health research. And so My sentiments were not unique, but rather are often shared by individuals who work in the community and by researchers that are familiar and passionate about community research. Angela Reyes, who I quote here, she's the executive director of the Detroit Hispanic Development Corporation, and incidentally also a member of the Detroit Community Academic Urban Research Center, which is a organization which has informed a lot of my approach to CBPR. And she says, conducting CBPR really involves a paradigm shift on the part of the researchers. Typically, the thought that comes to many researchers is that these are a group of people with no resources. They're poor, they're going to be uneducated, they might have all of these unhealthy behaviors, substance abuse, whatever. So there's this thought process going on saying that I have to come in and help these people. I'm going to come in and save them. They really neglect the fact that they're members of the community, leaders in the community, and residents in the community who are skilled, educated, knowledgeable, and can actually teach the researchers about what they're going to be doing in the community. And so this makes perfect sense to me. And I strongly feel that W.A.S.H should not happen if there is not a true collaboration between research and the community. And so what steps did I take? So I took many steps and many months, but I will try to summarize those in 5 key steps today so that I can allow more time for discussion. So, I first started with defining a framework, the community advisory board, very important step, a needs assessment, intervention development. And even though I listed as a separate step here, throughout this whole process, communication, a very, very important component. So, first off, defining a framework. So I first needed a guiding framework. And to this, I again turned to the international literature. And I selected the initiation, benefits, representation, legitimation, and accountability cultural humility framework. It's a mouthful, so I will refer to it as the IBRLA. And the IBRLA framework actually emerged through work with the Maori peoples of New Zealand, but I really felt that the components of this framework were very applicable to domestic work with the community that I was hoping to work with in DC. And the IBRLA framework in W.A.S.H is a living document. And so what do I mean by that? I mean that this isn't something that I defined initially and then I don't refer again until publication. It's really something that at each phase of the project, almost continuously, I review these 5 components to make sure that my research and project continue to be focused on the community in a culturally humble way, that it continues to be a collaboration. And throughout this whole process, I can't stress how much humility has been key. Because, having worked with the DC community, beginning in 1995, with the free community clinics. Then I, being a nurse of over 20 years at the Washington Hospital Center in Ward 5, my PhD training, right? My own lived experiences as a Latina growing up in government housing in Miami. It could be very easy for me to come in with this sense of cultural competence, right? But that I'm somehow an expert on this project and the creation of this intervention. But the more eyes community research has on it, the less likely it is to engage in unethical behavior, introduce bias of some kind. The more likely it is to be successful at truly engaging with and remaining accountable to the community. So I'm not a big fan of cultural competence, but I really, really live by this idea of cultural humility. And so very early on, while the project was still in the proposal phase, and defining how it would be guided by this framework, I engaged in several consultations and meetings. And in these consultations and meetings, I, for instance, met with Florencia Gonzalez and Finney Richardson, both from the GHUCCTS community engagement arm. And they provided feedback and also helped me schedule consultation with the Community Engagement Participatory Advisory Board or Participant Advisory Board. And this is a group of community members who have been engaged in research and volunteer to provide feedback and critique on proposals and research. And these services, incidentally, are available to any researcher at Georgetown and Howard University interested in conducting community research. I also met with Dr. Tawara Good. She's the director of the National Center for Cultural Competence. And incidentally, I also invited Tawara to come speak at one of our community advisory board meetings. And she truly provided a critical and expert evaluation on whether WA.S.H was meeting established cultural and linguistic competence. And we had these fabulous meetings. And she felt, in her humble opinion, that W.A.S.H does exemplify cultural and linguistic competence. Now, I just mentioned the CAB, that she came to one of our community advisory board or CAB meetings, and I've introduced our CAB members as a key component of W.A.S.H. And once again, you know, they are key in holding me accountable to this framework. So how did I create this kind of network? So it took over a year. And before I had funding or the proposal was approved, which I think is key because they were brought in at the very beginning or initiation of this whole endeavor, I contacted Advisory Neighborhood Commission for Ward 5, which incidentally was the only ward part of the original proposal. And through introductions with key informants from the community, I met other key informants and then met other key informants and stakeholders. I attended an ANC 5 meeting, thanks to Mr. Ramin, who was in the call, and introduced my study there. I spoke with other community members who were kind enough to provide their time to guide the beginnings of the study. And then I reached out to community members that were interested in health equity for Ward 5 and invited them to formally join the Community Advisory Board. I also extended the invitation to the laundromat owners who were interested in participating in my study. After having several one-on-one meetings with them, fabulous meetings, I might add, the laundromat owners I have connected with are often long-term residents of the community their laundromats are located in, and are really kind of committed to serving their community despite the pressures of gentrification that is going on in DC. And in fact, one of them is a former DC police officer. So we had a lot of fascinating conversations surrounding that and his now ownership of the laundromat. Initially, the CAB met more often via Zoom and email, but then we began quarterly in-person meetings this past October. And since this initial formation of the CAB, members suggested that we expand the study to include other wards. So remember, initially it was only Ward 5. I then initially suggested we expand to Ward 1, but the CAB felt it was important to expand further. So we decided as a group to include wards 4 and 7. So I continue recruitment into the CAB to make sure that we have representation from those wards as well. Currently, there are 4 laundromats that are part of the project. They each represent a different ward. You can see them mapped out here on your left. These are the various wards in DC, which there are 8 of. And we also have 3 additional laundromats in wards 1, 4, and 5 that are already part of the 3rd phase of the study. We're working on getting one for Ward 7. And so I mentioned the 3rd phase of the study. So the 1st phase of the study was completed this past March. And that was a needs assessment that recruited women from these 4 laundromats and asked them about their laundromat usage, their access to female health care, including distance, how easy or difficult it is to get an appointment, how comfortable they feel asking questions of their providers. We asked about the topics providers have discussed or not discussed with them, and also asked some questions about reproductive health knowledge generally. We had about 66 women participate in this 1st phase. of the study. And this first phase actually directly informed the second phase of the study, which is the intervention development. And the needs assessment not only informed the modality of the intervention, but also the topic. So again, not me coming in thinking I know how the intervention should run and what it should include, but rather having it be informed by the community it's meant to serve. So the needs assessment actually revealed that women did want access to health information, but sometimes didn't have the time to seek it out. So they welcomed the opportunity to speak to study volunteers and express an interest in an intervention that would come to them while they conducted the important laundromat work. They did express wanting privacy when it comes to learning about reproductive health information. And so that's something that we considered in the development of the intervention. And women in the laundromats across the board were, again, as long ago I observed in my dissertation phase, were observed mostly scrolling through their phones while they waited for their wash and dry cycles to finish, watching like Snap videos or Instagram videos. The topic that was selected was based on a series of questions about health and reproductive topics. And we scored those questions and then calculated the percentage of women that did not know the answer or got the answer incorrect. Top topics included fertility knowledge, pregnancy spacing, symptoms of sexually transmitted infections, vaginal discharge. So many women weren't aware of what is normal vaginal discharge or abnormal vaginal discharge. By far, 91% of the women, 91.7% actually of the women weren't aware what folic acid was for. And upwards of 50% of women felt that they didn't need to access prenatal care unless they had a complicated pregnancy or they were at least 4 months pregnant. So once this first prototype of the intervention was developed, we shared it again, phase 2. We shared it with the community advisory board to gather their feedback, made the necessary tweaks to it, and we will soon be sharing it with healthcare providers, including midwives, nurse practitioners, physicians, and registered nurses that work with women in the selected wards. And then we will come back to the community advisory board to get feedback on that phase 2 results. And then we will then be ready to begin phase 3, which is the actual launch of the intervention in 8 laundromats in these 4 wards. Now, I did mention that I do present step 5 as a separate step. That's mostly just to emphasize its importance, but it truly is ongoing throughout the whole project. So open communication with the CAB at all steps. Communication during quarterly meetings. We launched a website this past winter that includes information on the study there. I present at ANC or community meetings as needed or requested. I also am planning on introducing a future blog to the website. Now, of course, those venues, the blog, the website, even today's presentation are restricted somewhat in order to protect the unpublished research at this time, but hopefully soon I will be able to present all of those results and make everything readily accessible. Another very key component to community-based participatory research, making sure that the community gets the results of the work that you're doing. And so since the initiation of WASH funding last July, I have several times cycled and rinsed. You knew I needed to throw in a laundromat reference in there. Cycled, rinsed, and repeated through this cycle over and over again. Again, strengthening and recruiting for the CAB, continuing communication throughout the whole process, continual assessment. So not only a needs assessment of the community, but also an assessment of CAB needs and the laundromat business's needs, because again, this is a partnership between myself and the community, and then continual development and tweaking of this intervention. All of this within that IBRLA framework and guided by the CBPR principles. I won't get into too much detail on the CBPR principles just in the interest of time, but I do include the 8 principles that I use to guide my work. These are from Israel and colleagues from 2008. And incidentally, these are the principles that are promoted by the Detroit Community Academic Urban Research Center. The name escaped me for a minute, which is a collaboration between University of Michigan and Yale University Medical School. So one last word on these CBPR principles is that a very key principle of CBPR that I try to include in my research is that it shouldn't only engage with those parts that are directly part of the research, but with all aspects of the project. And so, for instance, all of my CAB and community meetings are held in the community. So rather than bringing the community to Georgetown, I bring Georgetown to the community. And this has been a wonderful experience for my research team, which is made up of Georgetown students. I have a couple of grad students, and I sometimes have upwards of 5 undergraduate students that are working on this research. And it's been a wonderful opportunity to actually get them out of Georgetown and engage with DC and familiar with the DC community and the work that's going on there. So a wonderful opportunity there. I cater the meetings for the Community Advisory Board, and these are from vendors in the community. So I try to stay away from the chains and really focus on making sure that I explore local vendors to engage with. We are exploring kind of ways for added benefits for our laundromat partners by exploring the possibility of bringing like little libraries or partnerships with art and muralists that have been successful in other locales. So that is something that Raw, if you're still on the call, we didn't get a chance to cover it at this last meeting, but it's on our agenda for the next one. So it'll be exciting to hear about that, which really kind of brings me to this last point as well. So community members will be involved in the actual intervention, and not as volunteers, but as compensated, valued participants. And this brings me to the final point. Again, to allow sufficient time for discussion, which are challenges. So important early challenges to conducting my work as an academic researcher. So for instance, the vendor onboarding process at Georgetown is very tedious. It involves a lot of steps that are very challenging when trying to bring a smaller community vendor on board. It just creates a lot of paperwork for them, a lot of steps, a lot of follow-up. And so that has been most definitely a challenge. The other one was participant incentives. So back at the beginning, when I was trying to advocate for cash incentives for participants for my first aim, I was prevented from doing that. At Georgetown, the policy is that we need to use these credit cards that allow the incentives to be loaded in later. So this created an added barrier of trust for the women we were working with. They were asked to provide addresses and date of births in order to register the cards. They also are limited in how the incentive can be used. So for instance, they can't use the incentive at the laundromats that they're currently in, at these coin laundromats, because there would be a charge or a penalty to the laundromat owners if they exchanged the card incentive for cash. So it required them to have to use these cards at larger businesses, and in fact they're even charged a penalty if they don't use the money within a certain time period. And I wish I would have brought it out. You should see it. The cards are accompanied by this 4-page very dense language that you often see accompanying a credit card application. And so it really kind of created a level of are we sure we want to participate in this study for my participants? So that's an added barrier when doing CBPR, because CBPR research, again, should be focused on the community. But here we're kind of forcing our participants to adapt to our established regulations at Georgetown, instead of making those regulations flexible in order to accommodate the needs of our community. Now, the turtle and the hare reference here, this is just a reference to the conflict in timelines. And so when I introduced my project to the community and the CAB and the different community meetings, everyone's extremely excited about it. And the community is kind of ready to proceed quickly through the steps of launching this project. But as an early career researcher, you know, I have to go through several steps each step of the way. And so progress is indeed slow from the point of view of the community. But we're excited to be launching phase 2 and hopefully phase 3 within this next year. So I hope you have a better understanding of WASH. Here on the left, we see one of my RAs, Jennifer Martinez Sanchez, who is doing some recruitment at one of the laundromats, and another picture of another laundromat, very nice picture that was taken by one of my research assistants. So I hope you were able to have a better understanding of the project, but more importantly, I really hope that I was able to convey the steps that I took to make sure that WASH is indeed a CBPR that is implemented through a culturally humble lens and truly community research. So thank you for the time, and I'm looking forward to the discussion.
I would just like to say bravo, Dr. Mirabal-Beltran. That was a wonderful presentation, and so much to highlight of not only community-based research, but our particular group is interested in the ethical components of various types of research. And you've done such a nice job of highlighting the intrinsic nature of the ethics as really bonded to the methods that you're using in community-based research. And I'm going to open up the floor to the attendees for questions, or you have someone also that might want to jump in from your team that we could also turn to for comment, which I would love. I would just ask you about your IBRLA. Did that, tell me again where that is coming from? Is that something that you put together from various sources?
Yeah, no, so that's actually published work. And it's published work that comes out of work that's taken place in New Zealand with the Maori peoples there. And I was particularly attracted by that framework because it really does a great job of acknowledging that relationship that a researcher should have with the community, which is, again, the one that I spoke about, which is the researcher is not the expert. The community is truly the expert of their lived experiences, of the barriers that they face each and every day. And so when we make the mistake of kind of coming in and thinking that, you know, these initials behind my name somehow give me a greater insight into the needs and barriers of the community, I think we make a big mistake because then we fail to learn from that interaction, and perhaps even worse so, we can actually cause damage to that community by bringing in resources that then leave with us instead of truly staying with the community. And so I was very attracted by that framework. And even though it's used more in international work, I feel that we can learn a thing or two about the work that we do internationally. Sometimes we feel that because we're doing domestic work that, you know, those same principles of ethics and humility and respect for local neighborhoods somehow are not as important because they are in the same country we live in. And I think that's a mistake.
Right. Well said. Community-based research really is highlighting that trust aspect, the ideas that you really were so thoughtful about transparency and accountability, equity and inclusion, and what a great example. I appreciate you spending time with us today, and that we have it on recording, because I can see so many places where we could use this conversation in a broader sense. We do have a comment that I'd like to bring up. I'm going to just read it out here from Ivy Ken. Wonderful work, thank you. In doing community-based research, it can be hard as a researcher to identify a deliverable. What is it that they need, and how, and can we give them that? Do do you have any advice for different things that communities might need?
Yeah, so thank you. First of all, I'm glad that you enjoyed the presentation. I'm going to address the questions in different parts. So the last one, advice for different things communities may need, we just have to ask.
Yeah.
You know, it really comes down to asking, because you know, when I initially thought about this project, you know, of course I had an idea of what the intervention would include and what it would look like. And that has since changed, because again, it needs to be informed by what the community feels that they need. And you have to kind of start that dialogue and that conversation with them. So I would be very, it would be difficult for me to give kind of general advice on the different things that communities may need. But one of the things communities all need is that we approach them with this cultural humility. That even when we happen to be a representative of that community, like, you know, I'm Latina, right? But my lived experiences as a Latina growing up in Miami, or, you know, as a white Latina growing up in Miami, is very different than the experiences of a white Latina, for instance, growing up in DC, or a Black Latina growing up in DC, or a Latina that identifies as Latinx, right? And so we need to kind of nod to those lived experiences. And so we can't just make the assumption that because we live within a community that we necessarily know what that community needs, which is one reason why the community advisory board is made up of so many different people, right? Laundromat owners, healthcare providers, key informants, community advocates, right? It's made up of different people representing different parts of that community. The other question, can we give them that? Now, I think this, I could have very easily, thank you, Ivy, Ken, for your question. I could have very easily added that as a barrier, right? Because oftentimes, what happens at community advisory board meetings, for instance, is I will ask, like, what can I help with? Like, what are the needs of the community advisory board or the laundromat owners? And sometimes those needs are easy for me to address, and sometimes not so much, because as a researcher affiliated with a academic center, I'm somewhat limited as to what I can do. But I'm always looking for creative ways. So for instance, one of our community advisory board members asked for some advice in dealing with another organization that she's working with. And one of the things I facilitate is I'm facilitating an introduction, right, to someone else that could perhaps help her work with that problem. So I think we just have to kind of think outside the box. And ideally with the W.A.S.H project, one of the deliverables will be the actual intervention. And one of the things I'm really focusing and looking at is how to make this intervention, of course, sustainable way after I'm gone. Right. And so with CBPR, I think that's one of the things we owe the community, right, is that we can't come in with this great idea, pilot it, write about it, you know, get it published, and then the idea just dies out, right? So we need to look for ways throughout the whole process of how do we make this sustainable so that the actual intervention, when it finally gets rolled out, and it is, whether it ends up being meaningful for research or not, if it's meaningful for the community, then I owe it to the community to make sure that it is sustainable and that it lives beyond my communication there.
I just so welcome your championship of the sustainability, because it is so well documented, but the actual, this is sort of boots on the ground, like responsibility to the community. And I so appreciate you highlighting that. I do have, we'll do one more question before we end up today. I'd like to end about 12:45, give people a chance to get to their 1 o'clocks. Question about regulatory. How was your experience in explaining this to the IRB?
Yeah, so well, that was where I first encountered the issue with the incentives. And so and initially I did push back initially, and then, you know, and then I decided to make it work. And again, kind of referring back to a phrase I used when addressing Ivy Khan's question, I did find interesting out of the box ways of addressing some of those barriers with the card. So for instance, I did create a little slip of paper that I had just like 2 sentences or so on it in English and Spanish that I actually stapled to the outside of the envelope that included the card. It had my name and phone number on it. So that if they ran into any questions at all, they could call me immediately. And so I did field some questions from the women. So they didn't have to like try to figure it out on themselves, like to read this like 4 or 5 page paper on how to use this card. I didn't force women to have to give me their addresses. So they were welcome to give me any address that they liked, including the address of the laundromat that they were being recruited from. I don't think that it was necessary for the incentive card to have their actual home address. This is a one-time participation in this study. So there was no need for them to have to give me their own personal address. So we encouraged women to just give the information that they were comfortable with. So outside of those though, Sarah, you know, the IRB was fine, right? Because I think that, you know, the main purpose of the IRB is really to protect the participants, to make sure that the participants aren't being, you know, taken advantage of in any way. And so from that sense of things, CBPR is really easy, because when you include a CBPR and cultural humble lens from the very beginning of your proposal, there's very little for the IRB to find issue with, right? And so I think that in that case, that's when it became very important for me to really kind of reach out to all of these different people, right? Tawara Good and Florencia Gonzalez and GHUCCTS and, and the community advisory board and individuals like Ramin, right? And all of these different people that I spoke with were important in making sure that IRB was smooth and not an issue. But the incentives are something that I'm still a little sore about, so.
Well, I will certainly bring it back to our REKS group, the Regulatory Ethics and Knowledge component, because we do have across our whole 5 institutes, we have meetings. And so I want to bring that back, and I will circle back with you.
Yeah, that'll be wonderful.
It's just now 12:45, so I'd like to thank Dr. Mirabal-Beltran for coming on today to share her research, and for the participants, and for those of you viewing the recording, thank you so much. And I'm going to go ahead and end the session.
And one last thing, I'm very passionate about this work. I'm passionate about working with communities in DC and this project. So if you have any other thoughts or questions, please feel free to reach out to me. I'm very easy to find. If you just type in Georgetown and my name, my email will come up, and I look forward to hearing from anyone that had any other thoughts or questions.
All right, thank you so much. All right, everyone, have a nice Wednesday. We'll see you next time. We are going to have, and the flyer did showcase our next meeting in July, or in August, excuse me. So please stay tuned for our next session, and have a good day. Bye-bye.